Borodar, Pab, good morning, everybody. Welcome to Health and Care Scrutiny Committee. Our main items today are likely to be in full confidential sessions. So to the public, this is a very short, likely to be a very short meeting. But before we get on to that, can we have any apologies, please, Carrie Ann?
Yes, we have apologies from Cabinet members David Selby, David Thomas, Jackie Charlton and Jake Berryman, committee members Alwyn Evans and Glyn Preston, and from officers Sharon Frewin and Dr. Richard Jones.
Okie doke. Declarations of interest. I know we've got one. Chris? You're on mute, Chris.
Thank you, Chair. I suppose I do need to declare that I am a member of the Powers Teaching Health Board as the local authority member, but because there is some reference made to them, so I will just declare that.
Yeah, that's fine. Thank you. Councillor Deb?
Yeah, I declare interest on both items actually. One is that I know people that work with Insure for the care homes, and the other is that I'm a trustee for East Radnor Care, which is referred to in the older persons as East Radnor Day Centre. Thank you, Chair.
Thank you. Any other declarations of interest on involvement with day centres or day opportunities? No. Okay. Disclosure of party whips? Nope. Work programme. It's just if you can just see that on there as to what we've got coming up in April. There may be some rejigging because that April, as you can see, that April agenda looks rather lengthy. So we may try and squeeze another meeting in, and I'm going to catch up with officers and Nina Davis on that at some other point. So moving on to the reasons why officers are proposing that these items are exempt. Please, can we have an overview from, I presume it will be from you, Nina, as to why the items on the older people's care homes and the day opportunities progress report are to be restricted, and then we'll take each one in turn as to whether or not we go into private session. Thank you.
Yeah, thank you, Chair. Good morning, all. Nina Davis, Director of Social Services and Wellbeing. Requesting to go into confidential session, exclude the public for the following items of business on the grounds that there would be disclosure to them of exempt information under categories 1, 2 and 3. Which is make information public, which is disclose information relating to the financial or business affairs of any particular person, and also individuals as well. We feel these factors outweigh the public interest in disclosing this information, and ask you can consider these factors when determining the public interest test to exclude the public. Thank you.
Thank you. Has anyone got any comments on that? I think the comment I would like to make is I fully understand that this is why it's confidential today, but as things move forward and you move into a position where people have been consulted and there's more awareness, that we should revisit whether or not this is in private session for each time that this comes back to scrutiny, because it's going to come to the stage where it's really important that the public see that all transparency is enabled for this. So yes, because of it being fairly high level at the moment, I understand that. So can I have so we'll take each one in turn. Can we have a proposer, please, then, for the older people's care homes item to be put into private? I've got Councillor Ange, Councillor Debbie seconding. Thank you. And then do we need to do the same on for item 8? Is that right?
Yes, please, Chair.
And again, it's similar reasons, isn't it, Nina? So as you've just explained, thank you, Josie and Carol. If I could, are you both proposing and seconding?
Yes, happy to propose.
And second, Carol? Yeah. Okay.
Yes.
Right. Yeah.
Thank you.
So we are on that note, we are, unless anyone has any objections, if you could raise your hand now. If you
Chair,
have yeah.
Chair, we've had the proposal and seconders, but we haven't actually formally accepted as a
Yeah,
group.
so I was going to say,
Oh, sorry.
Now, has anyone got any objections to that?
No.
To either of those? No. Okay. Well, on that, I'll take a majority view that we're happy to go into private session for both of those items then, please.